Hi, and welcome to your EMS safety course on bloodborne pathogens. If you're taking this course for work, it means that your employer has identified your job as one that can be at risk for bloodborne pathogens. So what are these? They are microorganisms, very tiny one-celled organisms, viruses, fungi, and bacteria that are found in all living things, plants, and animals. Some of them, pathogens, can be harmful and cause diseases. Bloodborne pathogens are disease-causing microorganisms that are present in human blood. Today you'll learn about the most serious types: human immunodeficiency virus, or HIV, hepatitis B virus, and hepatitis C virus. You'll learn how they are transmitted, how to protect yourself, and what OSHA requires your employer to do to protect you. You'll also learn what to do if you are exposed. In 1991, the Federal Occupational Safety and Health Administration, which you may know as OSHA, issued the Occupational Exposure to Bloodborne Pathogens Standard. It requires the employer to provide an environment safe from exposure to bloodborne pathogens. This includes using protective clothing and equipment, annual awareness training, an exposure control plan, and procedures to follow after an exposure. The Bloodborne Pathogen Standard was revised to require employers to select safer needle devices, to involve employees in identifying and choosing the devices, and to maintain a log of injuries from contaminated sharps. The Bloodborne Pathogen Standard applies to all employees who have a reasonable expectation of coming into contact with blood or other potentially infectious materials while performing their job. This applies to workers in a wide variety of occupations, including healthcare providers such as doctors, nurses, respiratory therapists, and phlebotomists, first responders including firefighters, paramedics, EMTs, and lifeguards, corrections and public safety officers, certain lab workers who handle blood or body fluids, tattoo artists, and body-piercing workers, housekeeping, custodial, or maintenance workers in certain settings, laundry workers if they handle contaminated laundry from a healthcare facility, or any employee with an assigned duty to provide first aid. HIV is a virus that breaks down the immune system by killing T cells, which help the body fight infection. Acquired immunodeficiency syndrome, or AIDS, is the most advanced stage of HIV infection. People newly infected with HIV may experience flu-like symptoms and then may have no symptoms for years. When signs and symptoms of HIV appear, they may include signs and symptoms such as persistent cough, fatigue, weight loss, diarrhea, abdominal discomfort, night sweats, chills, swollen glands, memory loss, increased illness due to a weakened immune system. It is estimated that there are more than 1 million people in the U.S. living with HIV and thousands of new infections each year. Many don't even know they're infected. HIV may be transmitted through exposure to blood, semen, vaginal secretions, breast milk, fluid surrounding the brain, spinal cord, lungs, and joints, amniotic fluid around an unborn baby, and other body fluids containing blood such as saliva during dental procedures. HIV does not live very long outside of the body and is not easily transmitted. Hepatitis B and C are viral infections that affect the liver. Viral hepatitis is the most common reason for liver transplants and the leading cause of liver cancer. Hepatitis B is more easily transmitted than HIV and hepatitis C virus. There are millions of people in the U.S. currently infected. Common signs and symptoms of HBV and HCV infection include jaundice, fatigue, loss of appetite, nausea and vomiting, abdominal pain, diarrhea, dark urine, and joint pain with HBV. So how are bloodborne pathogens transmitted? First, you must be exposed to the pathogen. Then it must be transmitted through a route of entry. Transmission of a bloodborne pathogen can occur when the blood or body fluids from an infected person or contaminated object enter another person's body. HIV, hepatitis B, and C are usually transmitted through unprotected sex, sharing needles during injection drug use, or during childbirth. HIV may also be transmitted during breastfeeding. Although transmission of a bloodborne pathogen is not common at work, it can occur through the following routes of entry: through a direct splash on the eyes, mouth, or nose, through a break in the skin such as a scab, fresh cut, puncture, or rash. Now, exposure is not the same as transmission. Transmission will also depend on the method of exposure and whether or not the pathogens are actually present and in what quantity in the blood or body fluids the person was exposed to. But even if a pathogen does enter a non-infected person, it does not mean that they will automatically become ill. It will also depend on the person's immune system, vaccination status, and the actions taken after exposure. Now that you know about bloodborne pathogens, how do you protect yourself from exposure to them? Universal precautions say to treat all blood and other potentially infectious materials as infectious, even without a diagnosis of an infectious disease. It requires the use of personal protective equipment and hand washing immediately after glove removal. Standard precautions, which are used by healthcare providers in hospital settings, go even further. They require you to avoid contact with all moist body substances except sweat. Personal protective equipment is protective coverings used to reduce the risk of exposure to bloodborne pathogens. You should use it whenever there is potential for exposure. Common personal protective equipment includes disposable watertight gloves. Use non-latex gloves when possible because of latex allergies. Protective clothing such as gowns, aprons, lab coats, and shoe covers, face shields, face masks, and eye protection, and CPR barriers or ventilation devices. Personal protective equipment must be provided at no charge by your employer. It should be readily available and stored in a convenient location. Personal protective equipment must fit correctly, and you need to be trained in how to use it. Put on the gown first, then the mask. Be sure that it fits properly. Put on the goggles or face shield next, and finally the gloves. There is also a sequence for removing personal protective equipment with the goal of limiting opportunities for self-contamination. Gloves are the most contaminated items, so remove them first. Next, remove the goggles or face shield, the gown, and finally the mask or respirator. Removing gloves safely can be a bit tricky if you don't know how. Let's look a bit closer at how to remove gloves properly. Pinch the base of one glove and slowly peel it off. Hold the glove in the opposite hand, slip 1 or 2 fingers inside the remaining glove, and carefully peel it off, creating a bag for both gloves. Dispose of them properly, according to your workplace policy. If possible, you should wash your hands before putting on gloves and always after removing them. Remove contaminated gloves carefully. If your personal protective equipment becomes exposed to blood or other potentially infectious materials, remove it as soon as possible before leaving the scene or work area. Now, just as there is a proper way to remove gloves, there is also a correct way to wash your hands. Wash hands immediately after glove removal with soap and running water. Rub your hands together to make a lather. Spend at least 20 seconds thoroughly scrubbing your hands. Rinse well under running water and dry with a paper towel or air dryer. If your hands are not visibly soiled and a hand wash facility is not readily available, you may use an alcohol-based hand sanitizer to clean your hands, then wash with soap and water as soon as you are able to. Another method of protection is the hepatitis B vaccine. It is safe and effective in preventing infection when exposed to the hepatitis B virus. If you have a reasonable expectation of exposure to bloodborne pathogens while performing your job duties, your employer must offer you the series of 3 shots at no charge. If you decide not to get vaccinated, you must fill out a vaccine declination form. Even with proper protection, exposure can still occur. If you are exposed to blood or body fluids, take the following actions. If you are exposed to a bloodborne pathogen or other potentially infectious materials, immediately wash your hands and affected areas thoroughly for at least 20 seconds. If splashes to eye, mouth, or nose occurred, flush the affected area thoroughly with water. Dispose of any contaminated clothing or objects in an approved leak-proof container. Report the exposure to your supervisor or designated person right away and follow up with a healthcare provider. The Exposure Control Plan is a written document developed by your employer to explain how it will comply with the bloodborne pathogen standard and protect you, the employee. The Exposure Control Plan is reviewed and updated annually, or more often if there is a change to risk for exposure. It is available to all employees. It includes engineering controls, which are systems or equipment that isolate or actually remove the hazard from the workplace. These include sharps disposal containers, biohazard bags, and self-sheathing needles. And work practice controls, which are systems or everyday practices that help reduce the risk of exposure. For example, hand washing or the use of personal protective equipment. An exposure control plan should also address the following housekeeping techniques. Clean blood spills immediately or as soon as possible. Disinfect the area with a mix of 1 part household bleach to 9 parts water or an EPA-approved commercial germicide. Regulated waste is material contaminated from blood, other potentially infectious materials, or cleanup. Dispose of it in closable leak-proof containers that are labeled or color-coded to indicate a biohazard. Warning labels must be attached to containers of regulated waste, laundry, or any items exposed to blood or other potentially infectious materials. Contaminated laundry must be cleaned by a professional service that provides pickup and cleaning. Contaminated sharps can include needles, scalpels, broken glass, or exposed ends of dental wires. Needle sticks are the most common form of occupational exposure to bloodborne pathogens. Handle contaminated sharps carefully and follow your workplace policy. Discard them in approved, properly labeled containers that are closable, puncture-resistant, and leak-proof. Use a brush and dustpan to pick up broken glassware that may be contaminated. Do not store food or eat in areas where it may be exposed to blood or other potentially infectious materials. Do not apply makeup, smoke, eat, drink, or handle contact lenses in areas of potential exposure. Thank you for taking the time to learn about bloodborne pathogens, how they are transmitted, and how you can protect yourself. Be ready to help your employer develop safe work practices and evaluate systems or products that could reduce risk. And always follow the policies your employer has set in place. When employers and employees work together, they can reduce the risk of exposure to and transmission of bloodborne pathogens while at work. Know where your personal protective equipment is kept, and make sure you have tried it on and it fits correctly. Get vaccinated against hepatitis B, and know where your employer's exposure control plan is kept.